officially 12:15. So we'll go ahead and get underway. Welcome everyone to Elevating Community Input to Address Rural Health Inequities. I hope you're excited about this presentation because I for sure am. I cannot wait to get underway and hear all of this great information. Um, During the presentation, please keep yourself on mute. If you have questions, we're going to have a question and answer session at the very end. You can type your questions into the chat box as the presentation goes, and I will read those aloud for the presenters and audience at the end. Or at the end of the presentation, you can raise your hand virtually and we'll call on you and you can take yourself off mute. No need to take yourself off camera if you don't feel comfortable doing so. That's completely up to you. Today's session, my good friend and colleague Sarah Michelini is online and will be handling any kind of technical issues that come up. So if you have issues with the WebEx platform, please message Sarah directly. And at the end of the session block, please remember to log on to the super cool Whova app and fill out the surveys because they help drive our next forum next year. And they also provide really good feedback for our presenters. So with that out of the way, it is my great pleasure to introduce Micah Ingram, Kai Jensen, and Grace Hokog. Micah holds a master's degree in public health, where she has studied health equity, maternal and child health, as well as nutrition. She now works for the Oregon Advocacy Commission's office, where she is leading the work on House Bill 4052, which declares racism a public health emergency. Kai worked with nonprofits like Mind Out and Outside In before joining the health equity team at the Oregon Advocacy's Commission office. Grace's passion for health equity and decolonization is rooted by her upbringing in the Pacific Islands. Her history of community engagement includes an Oregon ballot measure campaign to fund healthcare initiatives, social policy research at MDRC, and work at Salem Health. Grace holds a Bachelor's of Science from New York University and proudly serves as a public affairs specialist at the OACO. And with that, I'll turn it over to our awesome presenters. Thank you.
Thanks, Bill. I feel like a red carpet celebrity right now. I love the fancy intro. Hi everyone. My name is Micah Ingram. I use she, her pronouns, and I work with the Oregon Advocacy Commission's office, and I'm the health equity team lead. And before I jump in, I'm going to let my team go ahead and introduce themselves. So I'll go ahead and pass it off to you, Grace.
Thank you, Micah. Hello, everybody. Thank you for joining us today for day 2 of the session. My name is Grace Hokog. My pronouns are she, her. And I'm one of the project facilitators in this work. And I would also like to thank Bill for the wonderful presenter's voice. It felt very official. So I'll go ahead and pass it to Kai.
You're on mute, Kai.
Yeah, thanks
There you
everybody for joining. And my name is Kai Jensen. I am the other project facilitator on the team, and I use them pronouns. Quick shout out to our interim executive director, Terrence Saunders, and local celebrity here in the audience I see. Thanks for joining. And I'll pass it back to Micah to kick us off on our presentation.
Thanks. Yeah, so again, my name is Micah Ingram. I am with the Oregon Advocacy Commission's office, which is a small but very mighty state agency. And we do a lot of intersectional health equity work. Our team here in particular was hired under House Bill 4052, which declared racism a public health crisis in the state of Oregon. And that bill was passed in 2022. So it's been a couple of years since its passage, and our team has been working real hard on it ever since. And we're going to talk lots to you about the bill today, and then some of the recommendations that specifically touch on rural health inequities. And then if you see me looking down, it's because I'm using my mobile phone as a remote to move these slides. So let's see if it works on my end. Aha, okay, cool. So I'm just gonna do a quick little run through of some logistics. Oops, did not mean to do that. The audio has been muted for all participants upon entry, like was mentioned, probably has been mentioned in all of your sessions. The moderators, as they mentioned, will also help with us during the Q&A after this. Remember to fill out your after forum session quiz summary shindig thing that you're going to get in your email. And then these sessions are recorded, all the good things. And then just to add on, if everyone could whip out their mobile devices, we're actually going to have Slido questions for y'all to be a little bit interactive in the middle of this presentation. So please have your mobile devices handy. Okay, so I just want to do a little bit of some foundation setting. So House Resolution 6 was actually passed before House Bill 4052, which again declared racism a public health crisis in the state of Oregon. And there's two really important statements that are in House Resolution 6 that I just want to read out loud. So the first one is, whereas white supremacy was institutionalized through the development of policies and systems that ensure power, privilege, and resources remain in the hands of white men. And whereas racism in Oregon has left a legacy of trauma from one generation to the next, impacting Oregon tribes, Black and Indigenous communities, and people of color through a cumulative effect. Alrighty, so I'm sure most of you have seen some type of iteration around equality versus equity, graphics wise. The one that I saw was of folks trying to look at a baseball game, and so this one is with folks going on a bike ride. And so I just want to do a little bit of some level settings, particularly around equality versus equity. So so in HB 4052, it's again really focused around equality and equity, but there's really major differences between the two. And so we utilize an equity approach when reimagining how the effects of our systems impact people from communities of color and priority populations at a disproportionate rate compared to the majority of the population within Oregon. So this bill also recognizes the historical and contemporary injustices of how our government systems have marginalized and continue to marginalize communities across Oregon. And then equity recognizes the shortcomings of a one-size-fits-all approach and understands that different levels of support and resources must be provided to achieve an equal outcome. This will obviously help create an environment where all communities within Oregon are able to reach their full potential and well-being and are not disadvantaged by their race, ethnicity, language, disability, socioeconomic status, gender identity, and social orientation. So again, we are funded under House Bill 4052, and it's actually a bill that is split up between two state agencies. So the other state agency that we share this bill with is the Oregon Health Authority, and their agency is in charge of a mobile health unit pilot program. We don't really overlap between helping with mobile health pilot unit program and vice versa. So OHA really owns that piece of the bill. And then our piece of the bill is focusing on the community-led recommendations that we received over the first phase of this bill. And then those recommendations really are focused in on social determinants of health. So we've done a lot of the community work with asking about recommendations around alleviating racism. And then OHA has their part where they're doing a mobile health unit pilot program. So over the course of 18 months from the beginning of 2022 until the middle towards the end of 2023, we convened and collaborated with our 2 affinity task forces. So there was the Health Equity Advisory Leaders, otherwise known as the HEAL members, which were geared towards mainly just culminating a bunch of BIPOC individuals from the community. And then we had a second affinity task force called the Indigenous Health Equity Action Council, otherwise known as IHEC. Sometimes we call it the IAC. And that particular affinity group task force was solely just for Indigenous health or Indigenous populations. So that was more of a safe space for Indigenous folks. And then we had the HEAL, which was made up of BIPOC individuals from the community. So 2 different task forces that we were gathering recommendations from. And really the question that we asked folks was, what do you think could alleviate racism in your community? And we just worked over an 18-month process to really guide those conversations and gather all of the recommendations that we received and are now working on today. So the most important piece of this bill is that it's community-led and it's also community-informed. We worked with a number of different thought leaders ranging from community partners, local community-based organizations, and so on. So one of the biggest community-based organizations that we really worked closely with at the beginning of this process was the Oregon Public Health Association. And so we definitely owe a lot to them, especially for getting us off the ground with all of this work. We also worked a lot with tribal leaders and citizens in that community in particular, as well as other thought leaders who helped us design House Bill 4052. So our agency works or houses 4 different commissions, and we also worked with these commissions when gathering our recommendations for House Bill 4052. So the 4 commissions that are housed under the Oregon Advocacy Commission's office is the Oregon Commission on Asian and Pacific Islander Affairs, otherwise known as OCAPIA, the Oregon Commission on Black Affairs, which we usually call OCBA, the Oregon Commission on Hispanic Affairs, otherwise known as OCHA, and then the Oregon Commission for Women, which is otherwise known as OCFW. So we published an interim report last year, and this is a really big achievement. It was one of our one of 2 big deliverables for this bill. The first being an interim report letting folks know about the updates and progress that House Bill 4052 staff were able to work on. And so I highly recommend scanning this QR code or looking at the interim report after this session. There's a ton of really, really good information about how we gathered our task forces. There's a really good section around the Indigenous population and how we were really intentional around putting that task force together in particular. And then there's also really detailed information about all of the different recommendations that we received from community members. So our team ended up gathering over 100 recommendations across 6 areas of focus, 5 of those being social determinants of health areas. So those areas were healthcare access and quality, social and community context, neighborhood and built environment, education access and quality, economic stability, and then government processes, which isn't necessarily a social determinant of health, but in order to address racism, you definitely have to have a systemic approach. And so government processes is a really important one, and being able to recognize that there are a lot of things that are part of the government system that we need to be able to modify in order to address racism as a public health crisis. So as far as next steps, we need as much legislative buy-in as possible into the work that my team is doing. We also need to have buy-in from community members, buy-in from anyone that feels like they have interest or stake in the game in terms of alleviating racism in our state as we know it. So that's really what our team is doing right now, is just trying to get the word out about House Bill 4052, connecting with legislators, connecting with state agencies and CBOs, and trying to figure out how we can really make these recommendations come to life. We also are working on introducing legislation in future sessions. So although we are a state agency, we can be a part of those conversations with CBO and really being a voice on behalf of community. So our agency does have a really special part in all of this legislative concept building and things like that a lot of other state agencies are not able to participate in. And then again, just gaining support within the legislature during session is going to be really important. So we'll be definitely watching closely during the 2025 session next year, and just monitoring anything that we believe affects our communities. So I went over quite a bit with you all, but I think the main takeaway that I really want everyone to know is just that House Bill 4052 is in place. It is an actual bill, and our team is working really, really hard on it. And so with that, I'm going to go ahead and pass it off to Grace, and she's going to start diving into some of the recommendations that I mentioned and talk about how they affect rural communities.
Thank you so much for that, Micah. I would love to take the mic for this next portion. As Micah stated, these recommendations were convened during the first phase of House Bill 4052, in which Black and Indigenous communities and other people of color were asked what they would change in their communities in order to alleviate racism as a public health crisis in Oregon. But before that overview, I would first love to direct you to please scan the QR code on the slide. It will bring you to the platform that Micah mentioned earlier, which is called Slido, where we can all answer questions together and see the live feedback and results as we answer. We would love to have folks respond to 3 questions as we walk through this presentation based on these recommendations, and we're just curious to hear your feedback. You won't see anything on the screen until I open individual questions, so just have your phone out and we'll go ahead and go through that. And if your phone isn't available right now, I'll go ahead and drop the public Slido link, so any accessibility issues you can do on your computer as well. And secondly, I would love to drop a resources page that we have created so that as we speak through these recommendations, you'll be able to follow along with links and have the ability to share resources afterwards to both the folks in your organization and also in your community. So the first link is the public Slido if it's not working on your phone, and then the Canva resources public link. So I see Shay says we'll need a code also. So let's go ahead and the code, I'll drop it in the chat.
I went ahead and dropped the
Perfect.
hashtag code.
Thank you. Thank you. So if anyone doesn't see that in the chat, it's 1372900. But thank you so much for dropping it. And so in this second, it says the QR code doesn't work for me, but the link in the chat seems to. Either would work. So thankfully we have both. But if the QR code isn't working or defunct or non-functional, the website works perfectly fine as well, and we can walk through these together. So whichever works for you based on the code, just let us know. So for example, in the resources slide that I dropped, I just wanted to direct you that I have linked all 4 commissions here at the Oregon Advocacy Commission's office that Micah told you about earlier. Feel free to click each logo to direct you to commission-specific links, as well as these links that pertain to the recommendations that we'll be walking through. So Kai and I will be presenting the following 5 recommendations, which are directly relevant to rural public health in Oregon that our team has been tasked to implement. In our session, we hope to solicit feedback from community health professionals such as yourself and collaborate on building out recommendations for solutions that are created by and for BIPOC community members. And there's no better space than here today with the lovely folks in the room. The following 5 recommendations we'll be presenting are funding for rural produce access, accessible transportation in all places, improving emergency response and services, internet access for all Oregonians, as well as county-based pharmacy access. All right, so the first one is going to be funding for rural produce access. One of the problems that community had mentioned is that in rural areas, many Oregonians don't have access to affordable fresh produce in the towns that they live in. The solution would be to push accessible and comprehensive support programs, emphasizing both treatment and prevention to promote lasting recovery and well-being, especially as it pertains to culturally specific foods and nutrition, that there's no one-size-fits-all or broad brushstroke when it comes to nutrition and food. First, I would love to define food insecurity, which is defined by the USDA as consistent and equitable access to healthy, safe, affordable foods essential to an individual's overall health and well-being. Specifically, individuals who live in rural communities such as Central Oregon experience lower rates of nutrition security due to socioeconomic disparities such as poverty, low wages, high cost of living, and limited access to health and social services. Differences in food security contribute to long-term chronic diseases such as heart disease and stroke, cancer, diabetes, and obesity, all of which are leading causes of death and disability, especially for folks of color in the United States. There is currently some work being done, and we wanted to let you all know about the programs and services and how they've kind of come along through the state, but we'd also love your feedback on how to make these programs better, as that's the role that we play in this project. So the first resource that I'd love to introduce is the High Food, Desert, and Farm Alliance Group, which specifically aims to serve folks in Central Oregon through their Rural Food Security Program. So the Rural Food Security Program was funded by OHA and the CDC, in which only 10 programs across the United States were chosen, one being in Central Oregon, thankfully, in which they were tasked to develop action plans to prevent and reduce chronic diseases amongst people experiencing health disparities and inequities. They developed coalitions which built action-specific plans tailored to the needs and interests of their community, with the 4 rural Oregon counties served being Crook County, Jefferson County, South Deschutes County, and North Klamath County. Crook County specifically has an amazing food resource calendar, which they still regularly update. I know that sometimes when programs come into place, it seems to fall off the bandwagon a little bit. You never know if things are going to be updated. So I thought this would be useful to implement so that y'all can share this to any folks in your organization or folks impacted by food insecurity that you may come across in your work. So the Crook County Food Resource Calendar specifically has over 10 food pantries available in the area, and all throughout the summer updates on when they're able to restock the pantry. Something about that is their dedicated staff. They have dedicated staff to provide capacity to support these actionable goals rather than just giving food. They support and go into the communities with community-based organizations with 20 individuals across the county and the area so that they can work to uplift and implement their community goals rather than just providing food. It works in conjunction together to try to solve food insecurity. And something else that I also wanted to mention, which our team was personally really happy about, is that in this past 2024 session, there was a Senate Bill 1585, which passed and allowed access to hot foods for recipients of the SNAP program. So this can definitely help to alleviate some food insecurities, especially where there isn't very much culturally specific foods or food deserts in their area. So this, in part, through restaurants and programs and delis, for example, allows those who receive public benefits to receive hot foods, which should be a right. There's no difference between cold and hot. It's all about the nutrition that's being served. And so I'm glad that that was put forth. I'll now be opening the Slido interactive question for the first one. So the first question is, how far do you have to travel to get produce that is culturally familiar? The first option is 0 to 10 miles. The next is 10 to 25 miles, 25 to 50, and then more than 50. So in my case specifically, I live in Salem, and I know that some of my favorite foods local to the Pacific Islands are only available in certain grocery stores up in Portland, like H Mart or Uwajimaya. So for me, I would probably choose 50 miles since I'm considering what's culturally familiar and the things that I grew up with to feel at home and to feel like it's a part of my regular diet. So I'm seeing a few answers. Thank you to everybody who's participating. And I'll give about 30 seconds so that we can get everybody's feedback. Currently, right now, I'm seeing a lot of 0 to 10 miles, which is thankfully very good. I'm not sure where everybody lives, if it's rural or city, because I know we're here in support of communities who live in rural counties, and then not everyone here lives in a rural county themselves. Great, so I think I got about 20 responses so far. So about 67% of folks say that they have to travel 0 to 10 miles. About 17% of folks in the room have to travel 10 to 25 miles. And with this lowest percentage being 25 to 50 miles, 5% of people have to travel. And with over 11% traveling more than 50 miles. So I think that gives a good idea of the lengths in which we'll go to feel that it's important to have culturally specific foods. And I'm sure that it's definitely harder to receive in rural areas. So I'll go ahead and go on to the next number. And thank you everybody for answering. To the next recommendation. Alrighty, so the next recommendation says is accessible transportation in all places. So there are many places in Oregon where there's a lack of accessible transportation. Improving transportation itself will help families be able to access the hospital and their healthcare needs, the grocery store, and other locations in their community to have a higher quality of life. One of the quotes that we received from community members during the gathering phase of House Bill 4052, they mentioned that some of the barriers include transportation with refugee families specifically regarding geographical distance. They say that there have been experiences of refugees in their community who have low-income housing, which is often far from healthcare services, and they often don't have the transportation to be able to go to the hospital. Some of them don't have their citizenship status yet, and some of them also don't have the community or the family to be able to be here to support them, to bring them to that medical transportation, as well as that safety to be able to walk up to a hospital or ask for support. Those are the things that we take into account when considering the trials that people go through in order to receive equitable healthcare. So there are two current initiatives going on right now in regards to accessible transportation as it pertains to healthcare. One of the benefits is for patients, and then the other benefit is to providers of patients who serve Medicaid. So there are two programs available, NEMT, which is available to the public and also noted on the resource page, in which OHP pays for travel for non-emergent medical transportation, which allows people to access their healthcare that OHP covers, including travel via taxi, bus, or local ride service like Uber or Lyft, but also keeping in mind that Uber and Lyft may not be fully available in rural communities where there's a lack of workforce there available to provide ride service. But this NMT program can also include travel costs such as gas, meals, and lodging. And then on the flip side, for providers, the Ground Emergency Medical Transportation Program is a voluntary program that makes supplemental payments to eligible providers who provide qualifying emergency ambulatory services to Medicaid recipients. The problem is that there's sometimes a gap, and so that supplemental payment covers the gap between eligible providers and what Medicaid is able to provide. So there's a bit of a policy connection there made so that there's more of an incentive for providers to contribute to this program. And so I'll go ahead and open up the next Slido question. Let's see. So the question here at play is, have you ever heard of NEMT and GEMT before this presentation? Let's see. Or actually, I think we're actually going to skip that. So sorry about that. I'll reset the poll, but do hold your phones because that is for the next question. So I'll go ahead and pass it to Kai to talk about improving emergency response and services.
Thank you, Grace. So one of the issues that we heard from community members during our initial conversation was the issue that was outlined in the 2019 Oregon Rural and Frontier Emergency Medical Services report, which indicated that 100% of people or organizations reported difficulty with recruitment, training, and retention of personnel, and additionally faced reimbursement barriers as high as 80% for EMS provider agency participants, including Medicare reimbursement. It was just often unbillable, but commonplace calls such as lift assist, standby events, and non-emergency calls were still happening. In some areas, emergency response operation costs are not sustained from a consistent source and rely on voters approving levy revenue. This heavily impacts rural and frontier folks living in rural and frontier areas that see their ER response times increase. So we wanted to share some progress that has been made. We've had several different pieces of legislation. One of them is at the state level. House Bill 41, and then at the federal level, we also received a $10 million grant to improve resilience in rural communities. So we would absolutely love to hear from y'all as these funds are rolling out, whether or not we're seeing them impact your communities positively, because we know that when there's progress made on some of these recommendations, that's not the end of the process, and it's really important for us to keep checking back with community to ensure that that progress is actually positively impacting them. The next recommendation that we have to share with you today is regarding internet access for all Oregonians. When we talked to community, we heard things like when we try to access education, we have to sit in a parking lot at a library or a fast food place to be able to do our homework. Telehealth is really important, but not accessible if you don't have high quality broadband. There's no guarantee to have broadband without a public option, is what those community members shared with us. Only when you have high earning people is there good broadband currently. And we see that it's most accessible along the I-5 corridor. So again, I've got some good news to share with y'all about the progress that's being made. In 2023, Oregon got some really good news. At the federal level, nearly $700 million was earmarked for high-speed internet service in underserved areas of Oregon. The Oregon legislature also passed a House Bill 3201, known as the Oregon Broadband Bill, which tasked the Oregon Business Development Department's Oregon Broadband Office, or the OBO, to provide loans or grants to support broadband access, affordability, and adoption. So the OBO has created a 5-year plan to utilize these investments. And there are a number of programs within the OBO. So there's the Broadband Technical Assistance Program, the Broadband Deployment Program, the Broadband Equity Access and Deployment Program, and the State Digital Equity Programs, which houses 2 different programs, Broadband Equity Program and the State Digital Equity Planning Grant Program. So all of that funding that has been awarded is being rolled out with Oregon Digital Equity Plan included in that framework. And that was approved with an allocation of $9.9 million in initial funding to implement. So we're really excited to see how that will impact our communities. And again, this is one where we want to continue to hear from folks. Is this working? Are you seeing an improvement? We know that it takes time for the infrastructure and other funding to actually impact communities. So we'll be continuing to keep in touch. And the last recommendation that we have to share with you is regarding county-based pharmacy access. We heard from folks that in rural Oregon, many neighborhood pharmacies are closing and have closed, just like in urban places, but this can be much more impactful when it was the only pharmacy for 30 miles, for instance. And this is reducing access to prescription medicines, especially those that can't necessarily be delivered through mail order pharmacies. The community said access to certain medicines, there's a big barrier. The FDA is trying to get pharmacy access for all families, regardless of their immigration status. Sometimes there can be 3 different kinds of visits to the doctors, and your medicine can be really expensive. So we have there was a report that came out recently. This is also shared with you in that resource page called the Oregon Rural Pharmacies Report. And after all of the in-depth research that they did, they said the solution is to support pilot programs that support rural communities taking steps to distribute medications efficiently and cheaply. The Roundhouse Foundation is currently funding 2 pilot programs that improve access to prescription medications in rural Oregon. The first is with Red Cross Drug in LeGrand in partnership with the Elgin Health Clinic. And the second is with Murray's Drug in Heppner, Condon, and Boardman. The Roundhouse Foundation supported funding toward the purchase of a centrally located prescription drug locker unit located in Elgin Health Clinic that is open during business hours and allows residents to access the medications more quickly than if it was mailed through the U.S. Postal Service. And Red Cross Drug provides prescriptions to the locker unit. So that's a really great example of a community partnership that is working really well for the folks who live there. The Roundhouse Foundation is also helping to fund the continuation of a home delivery program through Murray's Drug to deliver medications to housebound individuals who otherwise couldn't travel to a pharmacy. This service is available in multiple languages and is able to support the diverse populations that live in Oregon because of that. So we're really, really excited to hear about some of the progress that's happening because we know that the pharmacy shortage is only getting worse. And we're hopeful to hear from y'all if you have heard of other types of solutions that are working in your communities. This is our last interactive question for you of the day. And that is, how far do you have to travel to access same-day prescription medication, or medication that you might not be able to get delivered through the mail? The options are 0 to 10 miles, 10 to 25 miles, 25 to 50 miles, or more than 50 miles. And I will let Grace give us a little feedback about how those results come in from y'all, and before we pass it back to Micah to talk a little bit more about some action items.
Perfect. Thank you, Kai. So I currently see 13 responses right now, so I'll wait a little bit for folks to answer. But currently I'm seeing the majority right now, 77% actually chose 0 to 10 miles. It's a little bit surprising, but not really considering the audience right here, but we're here to serve folks in rural communities, so that may be different, but it is really interesting to know. Says about 73% say 0 to 10 miles, with only about 18 to 20% saying 10 to 25 miles, and about 6% of folks, they have to travel 25 to 50 miles. I would personally be interested in where that person lives, the one who answered 25 to 50 miles. If you'd like to drop it in the chat, we'd love to know, but if not, it's okay. Your privacy is important. Yep, so currently it seems like the majority is 0 to 10 miles. And I actually do have one more question after this that I accidentally skipped, but it does relate to both me and Kai's recommendations. And I'll open that in just a few seconds. All right, so I'm going to close this poll, and thank you everybody for answering that one. So with a total of 78% saying they travel 0 to 10 miles, 17% saying they travel 10 to 25 miles, as well as 6% saying 25 to 50. Okay. Oh, thank you for dropping in the chat. Okay. That's what I was very curious about. So Jessica's located in Reedsport, from Reedsport to North Bend and Coos Bay. Wow. Okay, I'm going to close this poll. And then the next question I'm going to open, let's see, it pertains to both accessible transportation in all places, which I spoke about, as well as improving emergency response and services that Kai talked about. This question is, if you didn't have a car, how confident would you be that you are able to access medical care? With 1 being not confident and 5 being very confident. You know that if you booked a medical appointment tomorrow, you would be able to hop in your car and leave, and that would not be a problem. And I would say 1 is more, it's up in the air, it's not reliable, and it's something that takes a lot of resources or access that you may not have access to right now, and that's perfectly fine. So I'll give folks a few seconds to answer. And thank you for dropping it in the chat as well. We value those responses. And I'm reading in the chat, it says, when their family member experienced a medical emergency, it took cops an emergency more than 30 minutes to get to us, and that they live in the middle of town. Wow, that is such a shame, and I'm sorry that y'all experienced that. I've been unable to drive at a point in my life, and getting to the doctor was very challenging in my area. Completely agreed. I think driving is a privilege, and even I took the city bus for many years. I'm very experienced in that route growing up, so I understand how unreliable it is, and waiting outside for transportation, especially as it pertains to medical care, is really not it. So we really appreciate all the feedback that you're giving. So I'll go ahead and answer. It seems that 18 people have answered. If you didn't have a car, how confident would you be that you're able to access medical care? Says about 29% of folks in this room say one, that they're not confident in their ability to access medical care right now. And then see, the next being 35%, they rate 2 out of 5 stars. And then with 18% of folks saying it's about a 3-star rating, 6% of folks say it's about a 4-star rating, so they're a bit more confident in their ability to access reliable transportation. And with 12% of folks rating it 5 stars, that they know that they'll be able to access their medical care as needed when they're able to and when they need to. So we thank you all for being really vulnerable with these questions and being able to give us this feedback. And we really value your participation in these 3 questions. And Slido won't be used anymore, so go ahead and relax your fingers, but we still have a few action items, and I'll go ahead and pass it back to Micah.
Thanks. I'm going to go through these pretty fast just because I feel like we could benefit from having a little Q&A session after this. So yeah, we have 4 action item areas, all of them being really, really important to the work that we do. One of them is community engagement and partnerships. So make sure that you have a diverse representation on the feedback groups that you're asking information from. Admittedly, we could have done a much better job at making sure that our affinity group task forces were more diverse. And I think that, that goes to say for most initiatives, you can always do more. But really making sure that you have a very big diaspora of folks with lived experiences, backgrounds, cultural identities, and things like that when you're garnering feedback from folks. Our team has done a really good job so far of doing some community engagement. We've been connecting with our Equity Action Group, which is a group that we host once a month, which you will get the link and information to in the resources slide. We've also been connecting a lot with CBOs and federally qualified health centers in the area as well to talk about not only rural issues, but urban issues, suburban issues, and all the things. The next one is accessibility and inclusivity. Again, make sure that you still continue to have a diverse range of folks that you are asking questions from and asking their feedback from, but also making sure that these meetings are accessible and inclusive. So one of those things is just making sure that everything is legible and readable for folks, for everyone. One of those things is called the SCORM model, which is the Shareable Content Object Reference Model. And that helps folks. That's a model that our team uses when it comes to font sizes and things like that. And then just making sure that you are considering to travel to rural areas. So if you're asking folks to travel outside their means, maybe consider going to them. Another thing is also offering to pay for folks' transportation. I know that not everyone is able to commute for all of these really important meetings. And if it is within your organization's means, offer to pay for their transportation, give them a gas credit card or a gas gift card so that it's not taxable. Just really thinking outside the box when it comes to helping folks access these important meetings and things of that nature. So I'll go ahead and pass it off to Grace to talk about the last couple action items.
Thank you, Micah. And I'll go ahead and speed through or go a little bit quicker through these as well, because we want to hear your feedback, and that's why we're gathered here today. So for policy advocacy, the action item is to advocate for policies that support rural community development and eliminate health inequities. For example, being able to provide testimony on behalf of policies that matter to you and that affect rural communities. Let your voice be heard. You can speak as an individual or you can speak within your organization, whatever feels comfortable to you within your bandwidth, as well as providing testimony, not just in support, but also against bills. And it's a way of having your community voice heard through Oregon State Legislature. And we've also dropped that in the resources as well. The best practice is to engage with local policy makers to address systemic issues and advocate for policies that promote equity for rural communities, such as economic development, emergency services, transportation, access to nutritious food, job creation, and generally improved infrastructure for rural communities. We also dropped a link about how to find the legislature in your area or your local legislatures, as well as the general understanding that rural populations are diverse and expansive in terms of culture. Be be sure to aim for culturally specific framing when advocating for these policies. Across Oregon, but especially so in rural communities, there's a lack of providers who mirror the identities of Black and Indigenous communities and other people of color. So it's important to directly ask folks what they need to be cared for rather than using a broad stroke to solve health inequities. I think that's really important, as well as advocating for data collection and disaggregation, which allows for more focused data sets that allow issues within smaller subsets of populations like rural communities to be addressed more effectively. For example, it can be easy to say that there are quote unquote no people of color in a rural community, but that would actually be an erasure of their experiences and the hardship that they've experienced by being in a majority white community. So being able to collect data on a very specific level helps to solve that erasure of the communities rather than just dismissing and saying they don't exist. It's saying they exist in such small numbers, so let's go ahead and put forth more resources towards them. And finally, telehealth expansion, as we all know here, as we sit today is really important. We're gathering virtually in a way that we may have not otherwise been able to. So investing and expanding telehealth services helps overcome geographic barriers, can improve access to healthcare services, medication, and especially in remote areas where transportation and internet access infrastructure may be underfunded. So transportation, as we all know, enhances the access to healthcare facilities, while better internet supports telehealth initiatives, access to health information, preventative health services, virtual access to doctors, making appointments, and etc. I think these 4 action items, community engagement and partnership, accessibility and inclusivity, policy advocacy, and telehealth expansion is something that we can all take away from this presentation and go back forth and think of how ways to implement these in your own organizations as well as your daily life. And I think that's a really important part of this is integrating it into your daily life. And I'll go ahead and pass it back to Micah.
Thank you, Grace. We have some resources like we shared before, and hopefully you can scroll back up and find the link to those. If these QR codes are being fussy, we had to do a little last minute zhuzhing to them. Seems like it has caused us some trouble. But really excited to open up the floor. So thank you to all of the sponsors, and we would love to have the opportunity to hear some questions. I know we've had some good questions in the chat, and talk with y'all about some of the things we've shared.
Thank you all for the very awesome presentation. I'd like to give you a round of applause because normally if we were in person, the room would be erupting with applause. So, and I kept seeing applause pop up as you were talking. So, congrats! Yeah, and the applause rolls in as is well deserved, and the love. I love to see that. And it looks like for the most part, you all have answered questions as you went along. So bonus points there. That is so awesome. But if there's other questions that have yet to be asked, please type them into the chat box or don't be shy. Oh, it looks like we have a question from Jessica. Jessica, if you hand up, feel free to take yourself off mute. Oops.
Thank you. First of all, thank you so much. Pages and pages and pages of notes. This was exactly what I needed. Um, Folks who've been in other units or other sessions with me know I'm a veteran, and so I'm really looking with that very focused veterans lens. I'm also a white woman. I've always had a diverse group of friends, but I've also lived in more metro places. My last place that was big to live was San Jose, California. So, lots of diversity there. Um, what I've noticed here in the Southern Coast, particularly, we used to be the KKK stronghold here. Folks of color tend to keep they're here, but they tend to keep a very, very low profile, and they're very hesitant no matter, how open you are. So I want to know if there are any best practices. I mean, I'm just myself, and that's worked to some extent, but I would really like to connect with a majority of folks who serve in the military are BIPOC, people of color, particularly Native Americans, and that's especially true among the female population. So I'm just wondering if there are some best practices that you all would recommend. And I didn't even know you guys existed. I am so excited. So I will be contacting you for sure. But if you could just give me an idea of what I might do to be more effective, I'd appreciate it.
I can go ahead and try to answer this question in part and pass it to my team members if so, but I was going to answer your question in the chat. It says, can you speak to reaching out to diverse participants when they keep a low profile? Are there any suggested best practices? I want to reach out to all the veterans in my area. I think I have a great example from House Bill 4052 specifically, where we convened the Indigenous Health Equity Action Council. They reported information back to us, but no health equity staff were actually in the meetings where they talked about the health inequities that they experienced. So that's a way of saying, it's okay, I don't have to be a part of your space. I don't have to be a part of your community for these recommendations to be pushed forward or moved into policy, that, I'm not the gatekeeper of that information. I think that's one part, is being willing to pay for people to convene, pay for people's experiences, and also know that, you don't necessarily have to be a first-hand participant in order to push forward information in your organization. And secondly, I would say, as to keeping a low profile, I completely understand that. With keeping a low profile, I think that you have to go to community-based organizations that are culturally specific, that already have trust in their area. They put funds back into their community. They are direct resources to people who feel vulnerable. So reaching out to culturally specific community-based organizations first, and being a trustworthy person rather than just asking for information. So you have to display the trustworthiness rather than to say, here I am, and to please accept me, because there's a lot of historical context behind, you know, suggestions or actions like that. You have to show that trustworthiness, willing to show support, even if you don't receive it back, willing to have reciprocity, community values, and caring for the community rather than just extracting. And not to say that that's what you do, but just as a general, that's what I wanted to know. And I can also hand it to any of my teammates if they have anything to add.
That was beautiful. I think just to add one piece to what Grace had said about being extractive, I think again, like what I had mentioned in the presentation was just making sure that you're actually paying people for their time. Like folks of color, particularly in Oregon, are constantly being asked to put their input in, are constantly being asked to, speak about your experiences, tell us about how we can be better as a white company. And it's like, yes, we have all of these wonderful lived experiences, but it can be very extractive sometimes and also so draining. So if you are at an organization that is actually within the means to pay people for their time, that is well worth your money and your budget. Like being able to like actually give folks money and pay them, and like letting them know that their time is actually valuable and that you value it is really important.
Thank you, Jessica, for that question. Thank you for the wonderful response. That is fantastic. And we've got 1 minute, so we're really, unless someone has a quick question, I'm going to go ahead and take care of some housekeeping. But if you have a question, really quick, raise your hand or type it into the chat box. But we'll close with saying, thank you all so very much for being here. And thank you so very much to our presenters. This has been an awesome session, and it has been a privilege to be here and to moderate it and to listen in. So thank you very much for being here. For attendees, again, like the presenters said at the beginning of the presentation, this is going to be posted to the Office of Rural Health website along with the slides. And thank you all for being here so very, very much. And I hope to hear more from you all and work with you all in the future. Thanks. And
Thank you.
enjoy the rest of the day.
Thank you so much. And thank you, Bill, specifically, and to those who are supporting this. Take care.
Thanks. Bye-bye.